Alright, my name's Joey, and this is my health assessment head to toe health assessment. Knock, knock, knock. Just me, the student nurse. Provide for patient privacy, hand hygiene. Hello, Mr. Gilstrap, how are you doing?
Good, how are you?
I'm doing alright. So my name's Joey, and I'm going to be your student nurse today, okay?
Alright.
Alright, so today what I'm here for is to conduct a head to toe assessment. It'll take between 20 to 30 minutes. Is that okay with you? Alright. So the first thing that I'd like to do is get two patient identifiers. So can you tell me your name and date of birth, please?
Talon Gilstrap, August 30th, 2008.
Alright, Talon, and do you have any allergies?
No.
Okay. On a pain scale, 0 to 10, 0 being no pain, 10 being extreme pain, what would you rate your pain?
0.
0? Awesome. Alright, so we're going to go ahead and get this started, okay? So the first thing that I'm looking at is your appearance. What I'm looking for are any signs of acute distress. Acute distress would be something like you acting erratic, not appropriate for the situation, maybe being super diaphoretic, like sweating a lot, not making sense when you're speaking. You're not showing any signs of acute distress, okay? Next part is your level of consciousness, so showing how alert and oriented you are. So I'm going to ask you a series of questions. Can you tell me your name, please?
Talon Gilstrap.
Alright, Talon Gilstrap. Can you tell me where you're at?
My house.
Alright, and can you tell me what time it is?
3:43.
3:43. Is it during the AM or PM?
PM.
Alright. The last thing, can you tell me why you're here?
General checkup.
General checkup. Alright. So, in the medical field, we would say you're alert and oriented times 4, okay? You answered all 4 of my questions correctly. Next, I'm looking at your facial expression and your mood. I'm making sure that it's appropriate for the situation. Your facial expression, you're looking at me, you're paying attention, so your facial expression is appropriate. Your mood, you're light, you're answering my questions appropriately, you're being positive, so your mood is also appropriate for the situation. Speech, I've been listening to you talk. Your speech is clear, concise, and you're speaking in complete sentences. So your speech is within normal limits, okay? The next part of this assessment is your skin and nails. What I'm going to do is visually inspect your skin, and what I'm looking for when I look at your skin are any signs of lesions, wounds, or incisions. In the hospital setting, the patient would have on a gown, and I'd be able to look at their actual skin, front and back. For the purpose of the video, my son's got clothes on, so. Alright, so I'm looking at your skin, I'm looking at the front, visually inspecting. Can I see your back? Alright, so, I don't see any signs of lesions, wounds, or incisions on your skin, okay? Your skin color was also appropriate for your ethnicity or race, and even throughout, okay? Next, I'm going to look at your nails, alright? And what I'm going to do is I'm going to press down on the nail bed, and it'll turn white when I press down, and then the color should return fairly quickly, okay? Alright, so your cap refill was less than 2 seconds, which is within normal limits, okay? Also, your nail color was pink, okay? And can you do this for me real quick? Alright, and I don't see any signs of clubbing, okay? The last part of your skin is I'm going to check your skin temperature. So what I'm going to do is just take the front part of my hands, and I'm going to go down your body, okay? And I'm going to check the temperature of your skin, okay? Alright, so I would say your skin temperature is warm and it's moist, okay? And it's even throughout it. So that's it for your nails and skin, okay? Next is your head, face, and neck. The first thing that I'm going to do is I'm going to inspect and palpate your head. And what I'm looking for are any signs of any lesions or any infestations, okay? So I'm going to look at you first. I don't see any signs. Is it okay if I touch you? Alright. So I don't see any signs of any lesions or any infestations, okay? Next, I'm going to check cranial nerve 5. And I check cranial nerve 5 by soft, sharp touch, and then I'm going to have you demonstrate chewing for me, okay? Can you go ahead and close your eyes for me? And then just say yes when you feel me touching. All right. Close your eyes. All right. So this next part, I'm going to do soft and sharp, and I just want you to tell me whether or not it's soft or sharp, okay? And your eyes are going to be closed for this. Are you ready? All right. All right. Very good. Can you chew for me real quick? All right. Very good. All right. So, cranial nerve 5 is intact, okay? Next, I'm going to check cranial nerve 7. So, can you smile for me? Can you frown and wrinkle your face, your forehead? Very good. All right. Cranial nerve 7 is intact. Next, I'm going to check cranial nerve 11, okay? I check that by applying resistance to your shoulders and your head, okay? So first I'm going to do your shoulders. What I'm going to do is I'm going to place downward pressure on your shoulders, and I want you to shrug them up, okay? Very good. All right, next I'm going to apply pressure on one side of your face, and I want you to go against it, okay? And then I'll do it on the other side. All right? Very good. All right. So cranial nerve 11 is intact, okay? So next we're moving on to your eyes, all right? So with your eyes, what I'm going to first do is inspect for any redness or discharge, okay? So I'm going to look at it. I don't see any signs of redness or discharge. Now I'm going to pull down. Now I'm going to pull down your lower eyelid, okay? And what I'm going to do is that I'm going to inspect your conjunctiva, okay? What I'm going to look for is any redness or discharge, okay? All right, it's pink with no signs of redness or discharge. Then I'm going to look at your sclera, okay? Your sclera is white with no signs of redness or discharge, okay? So it'll look good. The next part is I'm going to look at your pupils, okay? The first thing that I'm going to look at is pupil size. All right, your pupil size is within normal limits, okay? Now I'm checking to make sure they're equal. They're both equal, okay? I'm checking the shape. They're both round. Next, I'm going to check to see if they're reactive to light, okay? Light and accommodation. So I'm going to shine a light, and they should both constrict, okay? All right, they constricted. And they constricted. All right, very good. All right, can you tell me what time it is on the wall? 3:45, and then follow this pin light for me. Very good. All right. So your pupils were equal, round, reactive to light, and accommodation, okay? So that's really good. Next part of this is I'm going to check cranial nerves 3, 4, and 6, all right? And I do that by checking the 6 cardinal, by doing the 6 cardinal fields of gaze, okay? So what I want you to do is you're just going to look straight forward. Without moving your head, you're just going to follow the light, okay? All right, very good. Cranial nerves 3, 4, and 6 are intact, okay? Next is your ears. For your ears, what I'm going to do first, I'm going to inspect the outside, the external structures, and look for any discharge, okay? No sign of redness, discharge, any inflammation, none of that in that ear. No signs of discharge, redness, no inflammation, no drainage coming out of the left ear, okay? So both ears look good. I didn't see any signs of any discharge, okay? Next, I'm going to test cranial nerve 8. I'm going to do that by doing something called a whisper test. What I'm going to do is I'm going to cover one ear, okay? Then I'm going to whisper a word in the other ear, and you're going to say it out loud, and then I'll do it on the other side, okay? All right, very good. Cranial nerve 8 is intact, okay? The next part of the assessment is your nose, okay? And what I'm going to do is I'm going to look at the internal structures, okay? I'm going to inspect them for any deformity, symmetry, any inflammation, okay? All right, I don't see any deformities, symmetrical, all right? And also, I didn't see any inflammation, redness, or discharge, okay? Next, I want to assess bilateral patency. So what I want you to do is I just want to make sure that you can breathe in and out of both nostrils. So clog your left nostril for me, close it up, and breathe out in and out of your right. Could you breathe in and out? All right, can you do it on the other side? Could you breathe in and out? Awesome, so you have bilateral patency, that's good. And as I stated before, you have no nasal drainage, okay? So your nose is good. All right, so next, we're moving on to your mouth and your throat, okay? The first part of the mouth and throat is I'm going to have you open your mouth, and what I'm going to do is I'm going to inspect your lips, your tongue, and your gums. And what I'm looking for is to make sure that they're pink and moisturized, okay? So can you go ahead and open them? All right, very good. All right, so they were your lips, your tongue, and your gums were all pink, and they all had moisture, okay? Next, I want to assess cranial nerves 9 and 10. And what I'm going to do is I'm going to have you open your mouth and say, ah. What I'm looking for is your soft palate, all right, and your uvula to rise, okay? Then also I'm going to test your gag reflex. Can you go ahead and open your mouth and say, ah? All right. Very good. So your gag reflex worked, all right? So I would say cranial nerve 9 and 10 are intact, okay? Next, I'm checking cranial nerve 12. What I'm going to have you do is extend your tongue side to side, and then I'm going to have you say a couple words, okay? Side to side, very good. Can you say light, tight, dynamite?
Light, tight, dynamite.
All right, very good. All right, so cranial nerve 12 is intact, okay? Cranial nerve 12 is intact. All right, so next is your respiratory system. What I'm looking at first is I'm looking to see if you're using any accessory muscles while breathing. Accessory muscle use would look something like you tripoding, which would be leaning forward, leaning on your palms, trying to gasp for breath, okay? Or seeing maybe your neck muscles flex, depression like by your clavicle or the skin. Those would all show that you're using accessory muscles, which means that you're having a hard time breathing, okay? You're not showing any signs of using accessory muscles while breathing. You're breathing at a normal rate and rhythm, okay? So you're not using any accessory muscles while breathing. Next, what I'm going to do is I'm going to also take your lung sounds, which just means I'm going to listen to your lungs through my stethoscope, okay? What I'm going to do is I'll just call out the part of the lobe that I'm listening to and what side, okay? And I'm going to do the front first and then the back, okay? Do you have any questions? Okay. So this is going to be done in a Z pattern, okay? All right. And breathe in and out. It's your left upper lung. In and out. Right upper lung. Right upper lung. Left upper lung. Right lower lung. Left lower lung. All right, and then I'm going to get the right middle lobe, okay? All right, and right middle lobe. All right, very good. All right, go ahead and stand up. And I'm going to do the same thing on the back, okay? All right. Left upper lobe. Right upper lobe. Right upper lobe. Left upper lobe. Left lower lobe. Right lower lobe. All right, and I'm going to hit that middle lobe again. Right middle lobe. All right. So I didn't hear any abnormal sounds. I did that in a Z pattern, okay? Your lungs were clear across all fields. I did the left upper and left lower lobes, and the right upper, middle, and lower lobes, okay? All clear across all fields, okay? So next, the next part of this assessment is cardiovascular and peripheral, okay? What I'm going to do first is I'm going to palpate carotid pulses, okay? Your carotid's located on your neck, and I'm only going to do one at a time, okay? Because that's how your brain gets blood, and if I do both at the same time, you could pass out, okay? So is it okay if I touch you? All right. All right. So I'd rate your carotid pulses at 2+, which is normal, okay? Now I'm going to assess for jugular vein distension. What I'm going to do is I'm going to have you lean back at about a 45-degree angle, okay? And I'm just going to look at your neck and see if I can see them pulsating out of your neck, okay? All right, you can go ahead and sit back up. All right, so I don't see any signs of jugular vein distension, okay? Next, I'm going to assess you for any edema, okay? Edema is just a fancy word for swelling, so I'm going to look at your upper and lower extremities and see if I see any signs of swelling, okay? All right, I don't see any signs of swelling, okay? There's no signs of edema. Next, I'm going to listen to your heart, okay? I'm going to listen to your heart with a diaphragm first, All right, and then the bell. Okay. Do you have any questions? All right. All right. So I'll call out the location and the structure. Okay. So the first one is your aortic valve, which is right sternal border, second intercostal space. All right. Then your pulmonic valve, which is left sternal border, second intercostal space. Erb's point, which is left sternal border, third intercostal space. Tricuspid valve, left sternal border, fourth intercostal space. And then mitral valve, which is left midclavicular, fifth intercostal space. All right. I didn't hear any abnormal heart sounds, okay? Next, I'm going to listen with the bell, and I'll just call out the structure, okay? Pulmonic valve. Correction. Aortic valve, I'm sorry. Pulmonic valve. Erb's point. Tricuspid. And mitral valve. All right, I didn't hear any abnormal heart sounds, okay? It all sounded normal. Next, I'm going to palpate some pulses, okay? And the first pulses that I'm going to palpate are your radial pulses. Your radial pulses are located on your wrist, okay? And all I'm going to do is I'm going to do them bilaterally, okay? So both at the same time. I'm going to compare the pulses, okay? All right, so I'll rate your radial pulses at 2+, okay? Next are your pedal pulses. Your pedal pulses are located right there on top of your feet, okay? So your radials were 2+. All right, and your pedal pulses are 2+, okay? The last pulse that I'm going to palpate is your posterior tibialis, which is right there by the ankles, okay? All right. I would go ahead and rate your posterior tibialis pulses at 2+ also, okay? Next is your GI and your urinary, okay? So what I'm going to do is I'm going to have you lay down, and I'm going to inspect your abdomen. And what I'm looking for is contour symmetry, okay? So can you go ahead and lay down for me? All right. So looking at your abdomen, your contour, so your symmetry, so it's symmetrical. There's no abnormal lumps or big bumps on one side. So your symmetry and contour are within normal limits, okay? Next, you gotta lay down, bud. Next, I'm gonna also take your bowel sounds, okay? Which just means I'm gonna listen to them with the stethoscope. I'm gonna start in the lower right quadrant and work in a clockwise fashion, okay? Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. All right. I didn't hear any abnormal bowel sounds, okay? Your bowel sounded normal. You gotta lay down. Next, I'm gonna palpate, okay? So I'm gonna feel your abdomen, okay? I'm gonna do it in the same quadrants, okay? Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. All right. I didn't. When I palpated your your abdomen, was it tender at all? Did it hurt at all?
No.
Okay, so you didn't have any signs of tenderness, and it's not distended. Okay, so it looks good. You can go ahead and sit up now. All right. So the next part of this assessment, okay, is musculoskeletal. What I'm looking at first is I'm going to inspect your elbows and wrists bilaterally, and I'm looking at symmetry and color, okay? So your elbows and wrists bilaterally are symmetrical and contours within normal limits, okay? Next, I'm going to inspect your knees and your ankle, and I'm going to do the same thing that I did for the elbows and wrists that I'm going to do for the knees and ankles, okay? And what I'm doing is I'm just looking for contour and symmetry. So I'm looking at your knees and ankles. Your knees and ankles, they are symmetric. The left matches the right, and the contour is within normal limits, okay? So that's good. Next, I'm assessing for range of motion, okay? So what I want you to do is straighten your arms out for me. All right, can you bring them towards you? All right, and away. All right, wrists up, away, around. All right, you have full range of motion with your elbows and wrists. Now with your legs. All right, can you bring them up? All the way up, down. All right, wrists or ankles, push them up, feet down. Can you move them around? All right, you have full range of motion of your knees and ankles. Okay. Next, I'm gonna assess your sensory function of your lower extremities. Okay. So what I'm gonna do is I'm just gonna touch you with this cotton ball. You're just gonna tell me yes. Okay. Close your eyes.
Yep, 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 yep.
All right. Very good. All right. So you have sensory function in your lower extremities. Okay. Next, I'm gonna assess muscle strength of your upper and lower extremities. Okay. All right. So what I want you to do is go up. I'm assessing your upper extremities now. Down, up, down. All right. So I'd rate your upper extremities. You have 5+ strength bilaterally. Okay. Next, I'm gonna assess your lower extremities. All right. Go up, up, down. All right. Up, down. All right. And I would rate your lower extremities bilaterally at 5+ for strength. Okay. The last part of this assessment is your gait. So can you stand up for me? All right. Can you take 4 steps that way? I'm just looking at how you walk, okay? All right. Turn around. Walk this way. All right. You can take a seat. So I would say your gait is within normal limits for your size and your age, okay? All right. Next, I'd like to reassess your pain. Can you tell me on a pain scale 0 to 10, 0 being no pain, 10 being extreme pain, how would you rate your pain?
0.
0. Very good. All right. I'm going to make sure your bed's locked. I'm going to make sure it's in the lowest position. I'm going to make sure the side rails are up. Here's your call light. I'd like to thank you for allowing me to do this head-to-toe assessment. Do you have any questions? All findings were within normal limits, okay? I'd like to thank you again. If you have any questions, just let me know, okay? All right, Mr. Gilstrap. You have a good day, okay? Hand hygiene.